Okay, so we're going to go through a nice little circuit here for people with shoulder impingement or rotator cuff pains. We just want to start by warming up our neck, warming up our trunk mobility and shoulders, and then get into some rotation finally at the end. If you have a test like moving your arms straight up to the side and coming overhead, or moving straight up forward, or coming into external rotation all the way, or reach up in behind your back, any of these kind of pain-provoking tests, bringing the arm across the body, that gives you a baseline to help you understand like what your pain level is at out of 10. You can do that now, and then do it again at the end after you go through one circuit or after you go through 2 circuits, and we should see that pain level coming down. Okay, so what we want to do is starting first with some head and neck range of motion. We're just going to do some forward, back bending, and just initiate a really deep breathing pattern. So we want to have fullest exhales and fullest inhales. In terms of the neck movement, we don't want to have any discomfort with this. We just want to move in a range that feels comfortable to you. So if you have any sense of like pinching or like a painful stretch, you don't really need to push into that. Just try to move in the window that's really accessible and comfortable to you. Okay, so next we're going to do a little rotation, just turning the head side to side. Imagine spinning around like a central axis that's running up your spine and through the top of your head. We want to avoid a reaching movement with your chin, like reaching the chin over the shoulder kind of thing. And instead just that nice kind of spinning motion. Again, we're not pushing hard into our end range here. We're moving in the range that doesn't have any resistance, and then as we start to feel some resistance, we kind of stop there and turn back. Okay, now we're going to do a little side to side. Continuing to breathe really deeply, so you can feel your rib cage moving up and down. And that actually affects sometimes how far you're able to move. So as your ribs come really far down and away, it's a little bit harder to take your neck all the way to one side. And as you really inhale and move your ribs up towards your neck, sometimes that feeds a little bit of slack into your movement. Okay, so as we're doing these ones, we think about reaching with the crown of the head kind of up and over, and trying to match or synchronize the amount of movement that we're getting from the head with the amount of movement that we're getting from the neck below. Okay, so if it feels a little bit uncomfortable sometimes as you move over, you try to reapproach that balance of like head tilt versus neck motion to the side, and see if you can kind of problem solve that and make a more comfortable movement pattern. From there, we're going to get into our shoulder circles. We're just going to kind of reach those tips of the shoulder blades all the way up and circle back around, pinching the shoulder blades together at the back, and then rolling them kind of forward, nice and slow. After about 5 repetitions, we can turn that around. So starting from the bottom, pinching together, rising up, releasing as you bring the tips of the shoulders really close to your ears, and then kind of circling back down and around. Nice and slow. Try to take your shoulder blades through the greatest amount of range of motion that's comfortable to you. Okay, from here we're going to do a little bow and arrow trunk rotation. So we're going to start in this position with the hands forward and slide one hand along like as if you're drawing a bow and arrow. Turn and look behind you as you exhale. Inhale as you reach forward, and then do the other side. Then exhale, inhale. Just follow your elbow with your eyes. And try to maintain broad collarbones throughout this movement. Feel how, as you kind of pull back, you can kind of open up that side of your chest and feel the shoulder blade peeling back along your ribs in the back. from there, we're going to do a little bit of external rotation for the shoulder. So you can take the pads of your finger, find the collarbone, run along the collarbone with your index finger, and then just come underneath that collarbone with your index finger, and then the pads of the next 3 fingers down onto the arm bone itself, keeping your elbow at the side. Rotate the arm out to the side. And we're just going to repeat that for about 10, sometimes up to 20 repetitions. This is one where maybe it's okay if you have a little bit of discomfort, like 1 out of 10. Or if you have no discomfort, ideally you can really try to push into your end range and find how far you're able to move that. Okay, from there we have our scaption exercise, which is, if you imagine you have a wall that is 1 foot in front of you, so I'm not straight out to the side here, but I'm 1 foot in front, almost at the level of where my knees are, and just kind of tracing an overhead reach in a bit of a circular pattern with the arms. This movement pattern allows the arms to move in a much more natural pattern, where the shoulder blade interacts really nicely with the rib cage. This is a pattern where you could see yourself doing things naturally in life, whereas this pattern where you're really straight to the side and moving overhead, we use more as a test of your range of motion, but it's not as natural to really be doing a lot of things in that position. So now you can go back to your test, whatever you tested initially, retest your movement, see if that feels better, and possibly repeat that sequence one more time, and see if you can kind of take the edge off that a little bit further, okay? That's a range of motion for a painful shoulder. Kind of an intermediate level, so not really like acute, severe pain, but when we have some mild pain in the shoulder and we want to kind of take the edge off of that, it's a great routine for you, okay? So hope it helps.